A 74-year-old man presents to the emergency department complaining of 1 hour of central, crushing chest pain. He is diaphoretic and ashen. Which coronary artery is most likely occluded? Options are A. Left coronary artery, B. A right coronary artery, C. Left circumflex artery, D. Proximal left anterior descending artery, E. Distal left anterior descending artery. Answer is B. Right coronary artery. The ECG shows ST elevation in leads 2nd, 3rd and AVF, with reciprocal depression in lead 1, suggesting an inferior myocardial infarction. This is most commonly caused by right coronary artery occlusion. A 54-year-old man presents with a 2-hour history of chest pain. He describes a tight band of pain across the center of his chest. He has a history of hypercholesterolemia and currently smokes 20 cigarettes per day. On examination, he is currently pain-free following intravenous morphine and sublingual GTN. His observations are within normal limits. His ECG shows ST segment depression in leads V3-6 and 1. There are no ST segment changes in the posterior leads. Which of the following statements is correct? Options are A. The diagnosis is ST elevation myocardial infarction. B. Primary PCI would be indicated if a troponin result was positive. C. The diagnosis is unstable angina. D. The diagnosis is non-ST elevation myocardial infarction. E. Non-ST elevation myocardial infarction has a worse long-term prognosis than ST elevation myocardial infarction. Answer is E. Non-ST elevation myocardial infarction has a worse long-term prognosis than ST elevation myocardial infarction. The diagnosis is ST elevation myocardial infarction. False. There is no evidence of ST elevation. Primary PCI would be indicated if a troponin result was positive. False, as this is not consistent with A. The diagnosis is unstable angina. False. This could only be confirmed with a negative troponin result. The diagnosis is non-ST elevation myocardial infarction. False. This could only be confirmed with a positive troponin result. Non-ST elevation myocardial infarction has a worse long-term prognosis than ST elevation myocardial infarction. True. Whilst in-hospital mortality is worse in STEMI, long-term mortality is greater in STEMI. A 65-year-old female presents to the emergency department complaining of a one-day history of chest pain. She describes a sudden onset of pressure across the chest with radiation to both arms. She has felt nauseous throughout and vomited once. She feels the pain increases with exertion. On examination, she is diaphoretic, tachycardic and normotensive. Which of the following features is most likely to be associated with acute myocardial infarction? Options are A. Pain described as pressure. B. Pain radiating to both arms. C. Pain associated with nausea and vomiting. D. Pain increases with exertion. E. Pain associated with diaphoresis. Answer is B. Pain radiating to both arms. Initially assess people for any of the following symptoms, which may indicate an acute coronary syndrome. Pain in the chest or other areas, for example the arms, back, or jaw, lasting longer than 15 minutes. Chest pain associated with nausea and vomiting, marked sweating, breathlessness, or a combination of these. Chest pain associated with hemodynamic instability. New onset chest pain or abrupt deterioration in previously stable angina, with recurrent chest pain occurring frequently and with little or no exertion, and with episodes often lasting longer than 15 minutes. Do not use people's response to GTN to make a diagnosis. Some patient groups, for example elderly people, people with diabetes, females, People with renal disease and people during a perioperative period are more likely to develop ACS with little or no chest discomfort. In such people, the dominant symptom may be breathlessness.